Welcome, everyone, and thank you for joining us on aHUS Awareness Day. I am Kim Quinlan, and I work as an Alexion Patient Education Manager. Today, I'll be joined by Alyssa and Dave Deffenbaugh, and we will discuss what it is like navigating everyday challenges with aHUS. Before we begin, I must mention that this event is brought to you by Alexion AstraZeneca, and although my fellow panelists are receiving a speaking fee for just participating in this program, we would not be here if we were not passionate about educating people about atypical hemolytic uremic syndrome as part of the aHUS Source campaign. We have to be mindful of FDA rules on communication. So if you post comments or questions via social media during the event, please refrain from discussions about or direct or indirect references to specific therapies or drug names. Additionally, this presentation is intended for U.S. audiences only. As this Facebook Live event is an educational disease awareness program about aHUS, we will not be providing any clinical guidance or diagnostic advice. If you have any specific questions about your health or symptoms, or are seeking medical advice, please speak directly with your healthcare team. The mission of the aHUS Source campaign is to educate, support, and connect people living with atypical hemolytic uremic syndrome and their caregivers by creating a community for people affected by this rare disease. I'm now excited to welcome Dave and Alyssa. Alyssa and Dave, thank you for joining us for this program on aHUS Awareness Day. Can you tell us a little bit about yourselves?
Hello, my name is Alyssa. I am from Rochester, New York, and I am an aHUS patient. I was diagnosed when I was 21 back in 2009, and I'm really excited to be here with you today.
And I'm Dave, obviously her father. And I also live in Rochester, New York. I'm retired, and I am involved now with the aHUS Foundation as my post-career and enjoying every minute of it. And thank you for having us on Awareness Day. It's an important day to our community.
It certainly is. Well, thank you so much, and thank you again for joining me. Today, we're going to discuss a few topics. Processing the news of an aHUS diagnosis, tips for handling stress in everyday life, and supporting loved ones who have a rare disease. So let's dive into our program and start with processing the news of an aHUS diagnosis. aHUS is a rare genetic disease that causes tiny blood clots to form in your blood vessels, blocking blood flow to important organs. aHUS can cause kidney failure, heart disease, and other serious health problems. While there is no known cure for aHUS, it can be treated. So, Alyssa, tell us about receiving the news of your aHUS diagnosis and even start back with some of your symptoms.
So I was 21 years old, and I was living what I would consider a normal 21-year-old's life. I was hanging out with my friends, going to school and working, and I woke up one morning with severely swollen eyes. I was throwing up a lot, and I was extremely tired. I spent a lot of days like in bed, just constantly sick. I wasn't even interested in watching TV, which is, not my normal, not my normal. So I decided once this had gone on for several days, it was time to see my doctor. I was still seeing my pediatrician at the time, even though I was 21. And I went in, they, checked me over, said they thought it was hand, foot, and mouth disease and to just go back home. My mom pushed back a little and wanted some testing done. So they did a urine test, and they said they couldn't test it because there was too much blood in it, which they blamed on my period, which I was not on my period. So that could not have actually been what it was. They sent me home and said to just sleep it off and get better. I spent a few more days doing the exact same thing, constantly throwing up, exhausted. So my parents decided it was time to take me to an adult doctor. And I went to see my dad's doctor, and they agreed and said it was likely nothing too serious, but they sent me for blood work and told me to go home and again, sleep it off. And that night I got a phone call from them saying to go straight to emergency, that it was serious and I needed to go in. And even still then, I thought I needed, fluids. I was dehydrated. I had been so sick. I still didn't think it was very serious. Even in the emergency room, I think I was the last patient seen because they thought I looked fine. I walked in, I was sitting there, I was laughing with my mom. I thought it was fine. Once they finally brought me back and drew their own labs, they realized how serious it was, and they pulled my mom into the hallway and said I likely wasn't going to make it through the night, that I was in complete kidney failure, and I was really sick. So my mom called my dad, got him in, and I was immediately brought to the ICU. I immediately started plasmapheresis and dialysis, which are all things I didn't even know what they were. And I was in the ICU for, I think, about 2 or 3 weeks. Then they brought me down to a regular floor, and then they released me, which I was excited about, but nervous. And I was only home for 3 days before I went back, and I was at home. I was about to go to a plasmapheresis treatment, and I woke up with a really bad migraine, like the worst migraine I've ever had. And I was really disoriented and confused, and I wasn't really making sense. My speech was slurred. So my mom called 911. An ambulance came to get me, and I went into seizures in the ambulance, which was one of the scariest things. I know it was even more scary for my parents watching me go through that, but it was awful. So that was due to my blood pressure being so high, which they let me leave like that from the first hospital that I was in because they said I was young and my body could handle it, which ended up not being true. And I had to be put into a medically induced coma. And I was in that for about 3 days. I had a, what's it called? Pneumonia, and they had to pump fluids.
You aspirated.
Yes, I aspirated my vomit, and they had to pump fluids out of my chest. And it was a long 3 days for my parents. I don't really remember it, thankfully. But so once they pulled me out of that, I feel like that is when I had my final diagnosis of aHUS from the doctor that we saw. This was a new hospital. And since then, I was on plasmapheresis for a long time. And then luckily in 2010, so this is 2 years after diagnosis, I got to have a kidney transplant and start treatment. And I feel honestly very lucky that I have that. I had the option to have my transplant and a treatment. And I feel like I live what I consider now a normal life.
Well, thank you.
As a rare disease patient. I should preface.
That. Thank you so much for telling your story. What an incredible journey that you've been on. Dave, as her parent, can you tell us from your perspective about Alyssa's diagnosis?
Well, obviously, it was very scary. I can tell a little side story with when she was taken up to the ICU. And as she had said, we were given, notice that, hey, she may not make it through the night. And I mean, what worse words can you hear from a physician? So they take her up to ICU and then totally cut us off because she had not signed a HIPAA form, was 21 years old. They wouldn't share any information. So here, Debbie, Alyssa's mom, and I are sitting there trying to get information, and no one will talk to us about what's happening with her. So my first announcement of the night: make sure you have a HIPAA form. You don't want to go in the hospital and deal with what we had to deal with, and they really stick to it. So it was difficult, but the early days were all children's. It was a children's disease. It was actually when the foundation for aHUS was formed, it was a children's foundation. And people just did not, you were not diagnosed older than 21. So very few doctors knew anything about it, especially if you're in a hospital where you're dealing with all kinds of practitioners. Nobody knew anything. So for both Debbie and I, it was terrifying to get the news that our daughter may not make it through a night and then not be able to find out what the disease is. It was a rough 24 hours to 36 hours till they really stabilized her. But her journey to a diagnosis was about 30 days. So an awful lot happened in between.
Yeah, from parent to parent, I can't imagine how scary and terrifying that must have been for you. So Alyssa and Dave, do you feel that aHUS diagnosis helped you understand Alyssa's health better or make you more concerned for the future?
Well, it kind of it was a good thing and a bad thing. I think it was a good thing because we finally had a name for it. And even when we told other physicians she has aHUS, they looked at us kind of glazed over. So, but at least we had a diagnosis, and we could, start to plan how we were going to move forward. The bad thing is that there was no information really available. There wasn't an aHUS pamphlet. There wasn't really much on any websites. If you went to good old Google, you found out that it had a 70% mortality rate. So it was, we call it the dark ages. It was an extremely, dark period for our patients, as there was no real treatment or medication. You just kind of hope to use plasmapheresis and dialysis to keep them going. I think that obviously we've come a long way since then. We have a treatment now. Physicians understand it better. So I think there obviously is a big change, and we'll talk a little bit about that later. But it was a tough time, and it still is. Every day I look at her, I'm just so thrilled that she's still with us.
Absolutely. So, Alyssa, can you tell us what you did to process and understand the news of your atypical aHUS diagnosis?
Yeah, when I was first in the hospital, to be honest, was just trying to survive. I blocked everything out that I could. I didn't really want to know what was going on. I just was like, just tell me what to do, where to be, just lead me in the right direction. Once, it became more a part of my life and I left the hospital, I went home and also Googled it. As my dad said, it was a scary Google answer, if that's what you call it. It didn't have good news back then. I'm glad now it's more optimistic and there's more options, but back then there wasn't, and it was really scary. Since Google didn't give me what I wanted to hear, I went to Facebook and I typed in whatever I could to get something to pop up that might make me feel better. And I found a friend in Arkansas that had also been diagnosed recently around the same time I had been, and was going through almost exactly the same thing I was throughout our journey together. We started treatment around the same time. We had our transplants around the same time. So she was such a wonderful person to find, and we walked each other through our journeys, and that was great. And I'm so glad that we found each other when we did. And I just think having people in my life that were there to listen and support me and be a part of my journey with me was really important.
Absolutely. That connection, to have someone that's gone through a similar journey, is so important. And we'll talk a little bit about that later, but I'm so glad that you found her. And Dave, how about you? How did you process and understand the news of this diagnosis?
Unfortunately, the same way she did, is going out, and I have to say, we were very lucky because we did end up with a hematologist that really understood the disease, and not all doctors want to share other doctors' names, but he encouraged us to get involved with, it was at that time the University of Iowa, which had done quite a bit of research on the disease. And that opened up all sorts of opportunities for us. We were able to take Alyssa out there and have her, diagnosed by them to make sure that we actually did have an aHUS patient with us. And we had quite a bonding with them. She was actually going to have her transplant out there, but some travel issues and that it ended up happening in Rochester. But when you're a parent, you're just like a patient. You're looking for answers, and we were able to find those answers through all these different sources that were kind of hidden, but if you dug deep, you could find them. Again, today's patients, there's so much information and good information out there right now. So if you're listening to us, don't worry that you're not going to be able to find out the information you want. There's so many resources, and we'll talk about that in a bit.
Well, Alyssa and Dave, thank you so much for sharing. So to recap this part of our discussion, we wanted to share that while every patient may present differently, the 3 most common signs of aHUS that most people living with the disease present with are kidney damage or kidney failure, hemolytic anemia, which is an insufficient amount of red blood cells in the body, and thrombocytopenia, which is an insufficient amount of blood platelets in the body. So living with this disease and the diagnosis can be very stressful, which brings us to our next topic, which is tips for handling stress in everyday life. So studies find that living with a rare disease can negatively impact mental health and the quality of life. Alyssa, can you tell us about the type of everyday stresses you experience after your aHUS diagnosis?
Yeah, when I was still in the hospital, stress was, like an everyday problem for me. Being that I had seizures because of my high blood pressure, that was something that I constantly was worried about for years. Anytime my blood pressure went up, which was every day when I was still in the hospital, every time I started a treatment, my blood pressure would go up and I would be immediately convinced I was going to go into seizures, which was absolutely terrifying to me. Even when they said I was likely not going to have any more seizures and I could go off my seizure medication, I was like, absolutely not. I need to be on this med. I need the security of it. I just think there was no security in my life, like nothing to convince me that I wasn't going to end up going back into the throes of everything. When I did finally get to leave the hospital, I was terrified to leave my house. I didn't want to go in public. I was so nervous to get sick somewhere or have something go wrong. My dad took me to my favorite play, and we had front row seats, and I made him sit in the back with me because I was so scared I would throw up or go into seizures or just faint, anything. Like I'm just always nervous something's going to go wrong. I luckily have gotten better, and I do go out places and enjoy life. And I just think it took baby steps. It took time. It took relearning to be in public and not just be so terrified. It has been 15 years since I was diagnosed, so I've had the time to get better and learn how to live my life with a rare disease. I was diagnosed with medical PTSD, so I do think that affects my everyday life all the time, but I think it gets easier and better with time, and I think you'll continue that way.
Good. Thank you for sharing that. And Dave, what actions did you take to help alleviate those stress factors after her aHUS diagnosis?
Well, initially, the entire time that she was in the hospital, we slept in a chair right next to her. Alyssa and I watched a lot of things happen in the world as we went through that process. But it's one of those things where we loved the medical support that she got, but they're overworked. That's the only way I can say it. And so I actually charted every medication that she took in an Excel spreadsheet. My kids to this day still pick on me for being an Excel junkie, but we found several mistakes where they were going to give a double dose of something. And so about all we could do at that point was just be with her and, help her through obviously what was an unknown time in what was happening to her. We watched her go through, several different stages where we thought that we had kind of turned the corner and, that she might be able to come back home on a regular basis. And each time that happened, something else would go wrong. So we'd end up back in the hospital. So I'd say Debbie and I, that was our life for particularly the first year that she had aHUS was 24/7, pretty much supporting her by being with her and finding out as much information as we could. I think that between the two of us, that we grew closer. It was a tough thing to watch her, but I think she appreciated both what her mother and than I did for her. So it brought us closer together as a family because you kind of appreciate how valuable and how quick life can change. And with her 3 brothers, they were very supportive too.
So, no, thank you for that. That's It's very powerful. Alyssa, do you have any advice for individuals newly diagnosed with aHUS who might be struggling with managing stress?
Yeah, I think it takes time. I think it takes baby steps, little things at a time. If you're nervous to go out, go one place for 10 minutes, go outside, take a walk, anything that gets you moving in the right direction. But also, I think it's okay if you're terrified and you just need to sit in your bed for 3 days. I think that's okay too. I also got a dog who I love dearly, and then got 2 more. So that is always helpful, a little companion to, if you can. I think that was a good thing to have in my life. I see a therapist. I think therapy is really helpful. It's really wonderful to talk to somebody about your feelings, someone unbiased who can teach you coping mechanisms. And I think for myself, I took something that changed my whole life and made it, it could have been, it is a negative, it's a super negative, but I tried to make it as positive as I could. And I did kidney walks, kidney foundation walks, I did fundraising, and then I started working with the aHUS Foundation, which I've been working with since 2015. And I feel like it gave this whole thing a purpose for me. And I feel like I can bring something to someone else that might need me, which makes this all purposeful, I suppose.
There's a reason for it.
Yes.
And Dave, what advice do you have for aHUS caregivers who might be struggling with managing stress?
I think Alyssa touched on it a little bit earlier too. PTSD is an issue. It was kind of a closeted issue for a long time. We thought PTSD was only, soldiers coming back from war and things of that nature, but caregivers definitely go through it. I can tell you a story of in one of our foundation meetings. What we do at the foundation conferences is we break off into separate groups. We have the caregivers go with the caregivers, and the patients go with patients, and those stories stay within the groups. And we used to focus and see most of the issues were in the patients' rooms. Now they're actually done early. I think they want to get out and get the break food that we have out there or whatever, but they do very well because most of them have a comfort level with their treatment and that they're, trying to move on with life as it is. But the caregivers never stop worrying. They'll always, as a father and Debbie as her mother, we will worry till we're not on earth about, how long will her kidney last? Will there be any issues with, if she gets pregnant, which we hope she does, but there's just always something hanging over your head. And I think caregivers have got to understand they're not alone. There are other caregivers out there feeling the exact same thing that you're feeling. And the story I was going to tell is that we had a mother there she started sobbing as soon as she started to speak. And she said, I love supporting my daughter with her aHUS, but my son today is pitching has his first start as a pitcher for his varsity baseball team. And I'm not here, or I'm not there. I'm here at the conference. So we have those issues to worry about. That are we just focusing on the individual, and it doesn't matter whether it's a child or a spouse. Is all of our attention going to that one individual, and we feel guilty that we're leaving the others out. So the strongest advice I can give you is contact and get involved with groups. It doesn't have to be an aHUS support group. There's caregiver groups out there of all nature, whether it can be cancer, heart disease, anything, because we all feel the same thing. It doesn't matter what the disease is, it's what you're feeling. And it is a focus now of the foundation. And when we do conferences, is we actually are putting more emphasis on the caregiver than we actually do on the patient, which sounds funny, but that's where we find the biggest demand for the issues that we have.
Well, thank you both for sharing. And I particularly love that you break apart at your meetings and caregivers are on one side and patients. So before we move on, I just wanted to recap some tips that might help improve mental health after a rare disease diagnosis. And these include finding an online community, finding the right physicians for your healthcare journey, seeking out mental health services, and prioritizing your health and mental well-being with healthy diet and self-care. And so Dave, you mentioned some great points about that. So it kind of just transitions right into our final topic, which is supporting loved ones who have a rare disease. And Dave, I'd like to start with you. How did you first support Alyssa with her diagnosis?
As I mentioned earlier, the first year was just basically being with her at all times to make sure she knew she wasn't alone, and trying to get as much information as we could for her. But then the next steps were to acclimate her again back out into the community, getting her, as she said, she loved the play, but went into what I would call a panic attack. And it was just she was uncomfortable being out even with her friends, out in public with them or shopping. And Alyssa was never shy about shopping, but she didn't want to go shopping anymore. So you have to, I'd say as a caregiver, what we had to do was go at her pace. We had to find a comfort level that she felt good with, but that we were pushing her forward so that she would, get us back to the regular Alyssa that we knew before as possible. Again, just I think at their own pace, but listen to what they're saying. Things that sound funny to you are not funny to them. They're feeling things that we aren't, able to understand and probably able to relate to. So you have to keep an open mind as to everything they're going through.
So Alyssa, after hearing from your dad, how did you feel supported from friends and loved ones?
I have always had such a wonderful support system around me. I have a wonderful family. I have wonderful friends. I have a few little stories that I thought showed how they cared for me and showed that they were there for me. When I was first sick and I was doing peritoneal dialysis, I was, tethered to my machine, had to sleep at home every night. And I woke up, I don't know how it all started, but my friends said they were going to take us out to dinner. We were just going to a dinner together. When I got there, the waitress had passed me a note that said, "Meet me in this hotel room," which actually sounds kind of weird, but it was, all my friends had booked a hotel for us. They had gotten my peritoneal machine from my dad and set it up at the hotel already, so I could go there and just, be a part of girls' night and not feel like I had to get home to get on my machine. They had brought it there. It was just, it felt so special, and I felt so loved and heard and seen, I guess. And another thing that I always think about when I think about my family being there for me, outside of my parents sleeping in my hospital room every single night and, always being there, is for my peritoneal dialysis machine, I had to have huge bags of solution that was attached to the machine. And we stored them in the basement because there were hundreds of boxes of them, which lined our basement walls. And my brothers would take turns every night carrying it up. And then my dad and mom would set up the machine for me and help me get connected. So it wasn't all on me. It was a team effort, which made me feel like I wasn't alone in the whole situation. And, my family is still amazing. I have a husband who's a wonderful support now. And my brothers are always still there to listen. And my parents are always, my mom's always watching, always making sure I'm okay. And it's just wonderful to have such a good support system.
Well, I love that story for you. That's really cute. I'm glad you felt so cared for. So Dave, are there differences in support options now compared to when Alyssa was first diagnosed?
Oh, definitely. And that's the happy part of the conversation. There's so much available now. Just the recognition of the disease as one for all ages, that when we started seeing patients diagnosed in their 60s, 70s, that all of a sudden general practitioners and that became more aware of the disease, just a general awareness through the medical community. And along with that then came pamphlets. There's actually information out there. The aHUS Global Alliance has got tremendous source of information. Different articles have been written by people both in the U.S. and in Europe, and it's just so different in that sense. But I would have to say the biggest change is a treatment. There is a treatment now that she's able to have and has had for a while. There are other treatments coming along. It's rare disease used to be where you nobody wanted to develop a prescription or a medicine for that disease because there's no money in it. But I think they've opened their eyes a little bit, I guess. And now rare diseases there's all sorts of treatments coming along for all sorts of rare diseases. And we're very thankful for that. So I think just in general, from doctors to treatments to information to, relating to PSD or PTSD issues, we've got all of that out there now that was never there before.
So Alyssa, before we close today's program, do you have advice for individuals newly diagnosed with aHUS who are struggling to find support?
Yeah, I mean, I hope any aHUS patient doesn't feel alone. I know when I first was diagnosed, I felt alone in that it felt like I was in an island and no one else had this disease. I think I was hearing numbers of like 1 in 1 million at the beginning, which was not the case, but it just was so, unheard of. Now I highly recommend going to Facebook, finding our group, finding our aHUS Foundation page, finding the Alliance, joining. And I mean, I'll join anything that I can that I know will have people that want to talk about this with me or with others. I also think finding podcasts about rare diseases or, being a patient or being a caregiver can be really helpful. Blogs, there's lots of blogs out there. I just think any way to show yourself that you're not alone is what I would suggest doing. I think it's really important to seek out a community.
Thank you. And so Dave, how about you? Do you have additional advice for other loved ones of people diagnosed with aHUS or aHUS caregivers who are struggling to show support?
Well, please come to one of our conferences. We've just announced we're doing one in Colorado in the spring, and we'll be doing one out in the West Coast, and we're actually going to New York City. Well, we're going to be in Jersey City, but I just can't overemphasize how important that is. There's nothing like talking face to face with somebody that's feeling the same thing that you are. And in most cases, you're probably thinking you're the only one feeling that way. But we have a wonderful time together. We have a little bit of fun, and we do an awful lot of sharing, and we even have a little educational aspect for those that are still interested in learning even more about it. But we'd love to see you.
Well, thanks so much both for your input, advice, and support of the atypical aHUS community and the aHUS Source campaign on Atypical aHUS Awareness Day. So this concludes our discussion on navigating everyday challenges with aHUS. So thank you, Alyssa and Dave, for joining me today. And thank you to everyone who tuned in for our discussion. I hope the information we discussed today was helpful and informative. I'd like to thank Alexion and AstraZeneca for making this event possible.